Welcome to So She Can Speak, a podcast from the So She Can organization.
I'm Alysa, one of the co-founders of So She Can and co-host of So She Can Speak. I'm 16 years old from St. Paul, Minnesota in the United States, and I love working to help people. Besides volunteering, I also enjoy playing volleyball, doing research, and video editing. I'm half Hmong and half Filipino, which make me very passionate about my identity and culture. And as an Asian female, I fully support increasing the representation of women of color in STEM fields, along with social justice issues like medical racism and women's rights or empowerment.
And I'm Celine. I'll be your other co-host on this podcast. I was born in New Zealand and I'm now living and studying in Canada. I'm passionate about education, human rights, lifting families and communities out of poverty, and making a change in the world. I want this podcast to be a place where we can grow and learn to be a more accepting community. I hope that one day I can become a doctor and provide healthcare to those in need.
So we'll talk a bit about the story behind So She Can, and it all started with an idea. What once was a mere thought I had is now a growing organization with members from all over the world, which is super cool, and I am so grateful for it. My passion for social justice issues, especially regarding how marginalized people are affected, has and continues to grow, which is why I started to form the concept behind So She Can Speak, our very own podcast. With our organization and podcast, Celine and I hope that you'll push past your limits and strive to do your very best. I know that growing up and life itself can be super tough, and it's said a lot, but your feelings are valid here. When you overcome your struggles, I truly believe you'll be stronger than ever.
So She Can Speak is a podcast from So She Can about social justice issues from the perspective of marginalized people. The podcast's goal is to inform you on important issues in the world and give a platform for marginalized communities' voices to speak their minds. By listening to this podcast, we aspire to prepare you to take the world by storm. Today's episode will focus on healthcare laws around the world. We'll also have a discussion at the end to give our personal experiences and thoughts. Whether you live in Mexico or across the Pacific Ocean in Japan, you'll be able to learn how healthcare might be near you and the issues surrounding it. We know healthcare might not sound super interesting or something you should learn about or relate to, but healthcare affects all of us, no matter your age or ethnicity. Take the time to tune in today and see whether healthcare in your country helps
or hurts you. But how do you know when healthcare is being unprejudiced and favorable rather than profiting off people instead? At So She Can, our writers defined a good healthcare system as having 1. A steady source of finances and funding, 2. A well-trained and paid workforce, 3. Well-maintained facilities, and 4. Access to adequate information. First, we'll look at Europe and their healthcare system.
In Europe, most countries have universal healthcare, which is known as an example of a good healthcare system. Universal healthcare is a system where everyone has equal access to quality healthcare, and seeking such care would not cause financial harm to recipients. Everyone pays for healthcare as a society, which lowers the expense and ensures that even those in poverty can get the care they need. Universal healthcare is the overarching system, but there are different systems within each European country. The 3 main ones are single-payer, government-owned, and privatized, but regulated.
The single-payer system is a system where the government funds some healthcare, but most of it is actually provided by private entities. Under this system, hospitals are usually privately owned and doctors have their own practice. But since people still pay a small portion of their healthcare, like insurance fees or things like that, that's why it's called the single-payer system. And the government-owned system is probably the most popular system in Europe, and this is where the government is essential and is the only health insurance provider. Under this system, the government runs hospitals and employs healthcare providers, which allow a good portion of medical services to be free of charge when doctors are employed by the government. There is some room for private-owned healthcare services, but it's expensive for the buyer and future patients. Britain, France, Italy, Norway, Spain, and Sweden all use variations of this system. Lastly, there's the privatized but regulated system, and this is where employed citizens earning less than a set amount are required to be enrolled in a public health insurance option. those who earn more than this amount can bypass the public system to buy private health insurance.
The main drawback of universal care is higher taxes for citizens. In some places, citizens have to give up half of their salaries. However, in many cases, those citizens pay in taxes similar or equal to the amount Americans pay for taxes, plus health insurance premiums. So in the end, their salaries could end up being similar.
And I'm pretty sure an example of this is in Denmark. I remember my geography teacher was talking about this one day, and she is obsessed with Denmark because their healthcare is really good. It's free, and they barely have any pollution and any conflicts in any way. I heard that a car is worth $100,000, even if it's only worth $20,000 in the U.S., just because they care so much about keeping their environment safe. But yeah, Denmark is one example. Other problems with these healthcare systems are that, especially in Europe, the elderly population continues to grow and increase, and so in the future they're not going to have enough resources to adequately care for the elderly, since like Celine said, taxes are higher for citizens, but elderly don't have to pay those healthcare taxes since they're already older and retired, and so this becomes a problem for the government to figure out what regulations and rules they need in order to adequately care for those older.
So next, let's move on to Australia.
Australia has one of the most comprehensive healthcare systems in the world. There's a huge range of services, but the system has two major parts: the public health system and the private health system.
Recovery time. In the private system, healthcare service providers privately own and manage private hospitals and specialized medical health and pharmacies. This is funded by a combination of the government and private entities. At private hospitals, patients can choose their doctor, and there's a reduced waiting time for elective or planned surgeries. And they have the choice of a private room, but they have to pay for this directly.
So we've thrown the term Medicare around, but now let's discuss what it really means. So Medicare is the government's health insurance in Australia, and it's a way to give the public access to healthcare. It provides benefits such as being a public patient in a public hospital, removes all or at least some of the cost of going to a specialist, and reduced costs on some prescription medications. But overall, Australia has a pretty good healthcare system. I read that their life expectancy is in the top 5 in the entire world, so their country keeps everyone pretty healthy and safe. But some problems arising for them, and I think in most countries everywhere, is the aging population. A lot of countries are struggling with how to deal with that, but in Australia specifically, they do not have very structured foundation for medical research. So although there are medical research breakthroughs that do happen in Australia, the foundation for that is a bit unstable, and they need to come up with more policies to ensure that everyone is getting all the diseases are being researched and data is gathered in the adequate way. And in Australia, I think this is a common problem in other countries too, but especially between Indigenous people in the country and non-Indigenous people, there's a big disparity between those because Indigenous people really have a lower quality of healthcare, and they themselves get more sick often compared to those in urban areas, because even though people who live in urban areas are exposed to more problems because they receive then good healthcare, they do tend to have better health than those Indigenous populations. So that concludes healthcare in Australia. Let's circle back to North America. Now we'll be discussing healthcare in the United States and Canada, and we know that these aren't the only two countries that exist in North America, but this is where Celine and I live, and a lot of problems and issues do occur. So in the US, there is also a mixed system of public and private insurance, as well as a third-party payer system. The most popular public healthcare program is Medicaid, which is for low-income people and individuals with disabilities, and Medicare, which is for people 65 or older and younger people with certain disabilities. The Department of Health and Human Services in the U.S. oversees the general health issues and concerns of all American citizens, and in 2010, the Affordable Care Act was passed. This law required most U.S. citizens to apply for health insurance coverage and says that enterprises with more than 200 workers must provide health insurance coverage to their employees. And in the US, I know that we're often compared to a lot of other countries for having a really bad healthcare system because you have to pay so much for insurance. And I think the biggest issue that many Americans commonly face is paying for prescription drugs or things like that. Like, I know my friends, they have peanut allergies, but the EpiPen shots, they used to be really a lot cheaper, but now they're over $200, and so it's a struggle to get their insurance to pay for it. But compared to a lot of other countries, I would say the U.S.'s system has a lot more issues just because they rely more on the people to care for the healthcare rather than relying on the government. And I think there was a lot of issues during our most recent presidency because Donald Trump made a lot of regulations to stop people from getting adequate health care, and it wasn't a main focus in his presidency. But with a new president coming around, maybe things will change in the US, but we'll see how things go. I'll pass it on to Celine to talk about Canada.
So in Canada, there is no single national health insurance plan. In fact, there are 13 separate provincial health insurance plans. However, the federal government is responsible for regulating important aspects of various health industries. Canada has a national health insurance program which is publicly funded as a single-payer system. This ensures that all Canadian residents have universal access to medical services. Similar to the US, the Canada Health Act provides a foundation for the Canada Health Care System. It establishes certain values and criteria that each publicly funded health insurance plan needs to meet in order to qualify for federal funding. So let's say that you break your leg and you have to go to the emergency room. They'll wrap it and they'll analyze the situation all for free, but if you're a dancer or you played sports or you really need your leg to fully heal, you will have to pay for physiotherapy or other things like that. And I think a common problem here in Canada is that the wait list is very, very long. So if you want to have a family doctor, you have to wait for months before actually, seeing the doctor, which in some cases isn't the best. So I know here we are quite happy that healthcare is provided for everyone and for free, but sometimes we do wish that things could go a bit faster, and I'm not sure how it works in the US, or is it quick or slow?
In the US, it's kind of weird because if you have to go to the ER, you have to wait in the ER room. And so that does get pretty long, and people still have to pay their own insurance for things like that. Which I know can be really annoying. I was actually a volunteer at the emergency room in one of the hospitals near my home, and a lot of people, it was really devastating to see because some people would be in really desperate need of care, and they were given higher priority compared to other patients there, but they would still have to wait 1 to 2 hours before they even got to lay down or something like that. And so by the time they were in their rooms, they would really be in pain. And another really bad thing that I wish the US healthcare system would change is that if you're not scheduled an appointment, if you're just going to the ER or something like that, you don't get as much proper care, I would say, if you would have to schedule with someone. I know a lot of people come in for issues that they receive, and then all they leave with is a prescription that they don't even have the medicine right away. They have to go walk all the way across the building to get it, or they would just leave and the doctor tells them to do a couple things. And so it's really a waste because they paid so much money only to get a little bit of advice. And so that's why I think a lot of Americans resent the US healthcare system, and also why a lot of Americans choose not to go to like hospitals because they know that they won't get the care that they really want or receive, and they don't think it's like worth the money. So I think that's definitely a big problem.
I think here the doctors are quite good, but I think one time we were at the emergency room and we waited for like 10 hours and it was super long wait. I think it's definitely helpful if you know someone, like you have a friend that's a doctor, because my brother, he once like broke his finger or something while he was playing football, and he went into like the emergency room pretty quick and they got him out pretty quick just because his friend's mom was like a doctor or something. So that, I think that's definitely helpful in some cases.
Yeah, and I'm not saying that like our doctors are bad or trying to like diminish our system. I just think that the amount of help people need outweighs the amount of help that people get or like that doctors can give people. But hopefully that can change in the future. I know we both want to get into the healthcare system, and so I'd be really interested to see like what I can do as a doctor, maybe not a politician, but as a doctor to like change hospital policies and try to improve things for patients.
Looking a little bit south geographically, we can discuss healthcare in various parts of South America. Each country has their own unique policy that differs from one another, but there have been great improvements in the last decade. Latin America is starting to move toward universal healthcare, and the process of it is serving amazing impacts for their citizens. Starting off with Brazil, they've started a universal healthcare system that is tax funded. All Brazilians are eligible for it. Their system invests in primary care, health promotion, reforming unhelpful strategies, and even offers home visits for families. Their program is used by 70% of the population. They also have a family health program, which are encouraged for lower class families to use as they may not afford other forms of healthcare. However, there are 2 doctors in the country for every 1,000 people, so there is a large lack of adequate health services. Another component of their system is the private healthcare insurance. This is to have another form of care as well. They also have private hospitals and clinics, which in comparison are much better than the public system.
Next, moving on to Argentina. Argentina is considered to have some of the best healthcare in Latin America or South America. They also both have private and public healthcare plans. Usually, costs for a specialist at a hospital can cost from $17 to $50 in USD. Their public insurance covers about 50% of the population. The public sector supplies free care in hospitals for all patients. They charge outpatients for medicine, and mostly their healthcare accessibility and plans happen at the municipal levels. Some healthcare plans are at the national level. For example, they have a healthcare plan named Plan Nacer to help children and mothers have free healthcare. Over 1 million mothers and children benefit from this government plan. In the private sector, it covers about 5% of the population. Patients pay for all their medical costs. These are high-quality clinics and hospitals, and it is also a hotspot for cosmetic procedures. The modernization of their systems and procedures is what makes people very drawn to it.
And now we're moving on to Mexico. Mexico is a blend of both government plans and private and public hospitals. They have 2 main paths of healthcare from the government, and hospitals have similar types of care. There's the private out-of-pocket. So some people choose private hospitals or to pay from their pocket when a medical emergency arises. What is good about hospitals in Mexico is that they say their prices beforehand and there are no surprise fees at the end of it. Private hospitals give patient experience similar to U.S. hospitals. Private hospitals and government care programs. So in government hospitals, the patient's relatives are supposed to provide care for their patient other than the medical, such as meals and general help. They have less staffing available as well.
And then the 2 medical system paths in Mexico are as follows. There is the IMSS system, which is for employees in Mexico. It costs $40 per month, and it allows people to treat their diseases or harms at no cost, including their medications. Those who have permanent or temporary residency can also apply. Pre-existing medical conditions are not eligible for IMSS, such as cancer or diabetes. The other healthcare program the government offers is Seguro Popular. This is for those who do not have IMSS. Anyone can apply without worry about the ability to pay or having pre-existing conditions in a contract. And the main caregiver of a house can apply to Seguro Popular for their whole family. The fee annually is $0 to $500 per year in USD, and it includes free medication if the supplies are available. And so, like every other country, there are some setbacks that Latin America system specifically struggles with. In Latin and South America, it is known that their mortality rates and like pregnancy deaths is very high amongst pregnant mothers or infants, and this is due to the kind of systemic problems that each country faces, whether that be through poverty or hunger, things like that. But because of that, those low-income families really struggle with getting the enough care, and there's a lot of very high populations in many like Latin and South America countries, so the hospitals are often really crowded or you have to wait a long time. And so those are some of the drawbacks in South America. In Latin America, their government is also considered by other countries to be more unstable, and because of this, the government doesn't take as much steps into reforming healthcare there. So those might be some of the things that you might see if you were to live in South America.
So now let's move on to Africa.
Now we'll be talking about healthcare in certain African countries, and the reason our writers chose these specific ones are just because they accurately reflect the country's healthcare situation in surrounding or neighboring areas and regions. So, Celine, we'll be starting with South Africa.
So in South Africa, there's a ratio of 1 doctor per 1,000 people, which leads to hospitals being overcrowded, poorly equipped, and they have long waiting lines. And a lot of this is because the government only spends 9% of its GDP to finance the healthcare system.
Yeah, so government spending, this reflects how little of a priority Africa sees healthcare to be, and that they might value gaining profits from its economy rather than helping the safety of their people. And the statistics from South Africa are very similar to that in Nigeria, which might be even more dire, since there is only a ratio of 1 doctor per every 2,000 people. And this is also shown because only 3.7% of Nigeria's total GDP goes towards financing healthcare. And the country also has a national insurance scheme, though, which is a plan to help support lower income families get adequate healthcare needs. And so this is designed to keep countries or to keep people better in better health, but there's still a lot of problems with it because it doesn't accurately reach out to all the people that it's supposed to help.
So in Zimbabwe, there's only 1 doctor per 10,000 people, which is a huge lack of doctors, which also leads to unreliable infrastructures in hospitals.
And in Africa, there is a great lack of healthcare professionals, since people who do decide to pursue healthcare careers in Africa know the struggle with dealing with all the patients, and there's such a high ratio between doctors and patients. They decide to immigrate to Europe or the US instead to pursue healthcare, since they know that their work over there will be a bit easier and they would be better accommodated. Also, since a lot of African people are in poverty, their children in school are encouraged to just get enough education and eventually work and get money rather than pursue higher education and get a college degree or something like that. And because of the big disparities between lower income people and high class, the amount of information that low income people get is very little, so they're not as easily able to pursue these careers in STEM. We will only be covering a few Asian countries for our podcast for now, since most of the countries we are covering also relate to similar aspects that are found in other countries in the continent. First, we have Singapore, and Singapore is known as the medical center in Asia, specifically Southeast Asia. They have several types of insurance systems that we'll get into shortly. Their healthcare system is financed by 2.75% of their total GDP. Their doctor to population ratio is 2 doctors per every 1,000 people, though.
So Medisave is a national savings insurance that helps save for medical expenses for before and after retirement. Based on age, CPS members take a small percentage from your monthly wage. It can be used for themselves and approved dependents. For example, you can use it for $150 per day for inpatient psychiatric treatment, with the limit being $5,000. MediShield can pay for certain outpatient programs and large hospital bills. Only certain types of wards, government hospitals, and a few private hospitals. Lastly, MediFund is similar to MediShield as it helps for those who have financial troubles paying for these medical bills.
So compared to other Asian countries, Singapore has a more specific and I would say more planned out insurance program, but other countries still have good insurance programs for their citizens. In Japan, for example, the government pays for most healthcare services, and healthcare there is seen as overall pretty well. The only problem they do have right now is Japan is known to be one of the countries with the most rapidly increasing elderly population, and there's not enough space or resources to accommodate for them. And then in China, 95% of the population has basic health insurance coverage, and there have been a lot of laws that are focusing on getting healthcare coverage for everyone. I know that I'm in Chinese class, and my Chinese teacher told me that because of this free healthcare situation, waiting lines can also be really long. And I thought it was really interesting in China that they have it more set up where it's very open. I don't know if you've seen it before, but there's pictures where all the doctors have their own table, and they're all in the same huge auditorium room, and then there's just people lined up to get ready to go and talk to a doctor. And so it's not really they have their own rooms, but that way they get more. To me it seems kind of like the urgent care of healthcare in China. And then in Thailand, they do have universal healthcare, which is the same as in South Korea. South Korea is known to have a lot more regulations when it comes to healthcare, and their government does step in more when it comes to the financial needs that people have to pay. So this can be a downside because medical staff in South Korea do make less money than in the US, since the government limits the amount of money that hospitals can charge to their patients. And because of this, a lot of healthcare professionals also immigrate to other countries in Europe or North America.
So in Indonesia, there's a ratio of 1 doctor per 5,000 people, and government only spends 2.9% of its GDP on healthcare, which is very, very low.
Well, that concludes the rest of this podcast episode. Thank you so much for listening, especially if you listen to the end. Please stay tuned for more updates, announcements on our Instagram, which is @SoSheCanOrg, and check out our website to learn more about our blog posts that will be published soon. And if you're interested in joining our team, applications are still open, so you have time to apply, and we'd love to speak with you soon. So thank you so much.